So we have quite a few devices that can reduce fat and tighten skin non-surgically. So we have things that can do it surgically as well, but let's talk about the non-surgical things. Our newest addition is actually CoolSculpt. We have several of those machines now. So what CoolSculpt does is it actually will freeze your fat, and in that process the cells die. So over about 3 months after having the fat frozen, the cells eventually get broken down and taken away by your body, and that area shrinks. We also have some other devices that can shrink the skin and reduce fat to some degree. We have Excellus. Excellus is a radio frequency device. Now what that does is heat the tissues. If you heat fat to a certain amount, it also dies. It's the advantage to CoolSculpt is it's probably a little more effective with one session, though multiple sessions of all these things usually is better. Excellus, you really do need multiple sessions. The advantage to Excellus is you also can get the skin to tighten a little bit at the same time. So in some people Excellus works better, and other people CoolSculpt works better. And in some instances you can do both, but not at the same time. We also have Baisers Shape. Baisers Shape is an ultrasonic device. That's more for cellulite, and it's one of those maintenance type machines. It's great for reducing swelling, so we use it after liposuction. But it's also good for people with a little cellulite in the back of the legs. They want to just sort of tone things up for the week, but it's one of those things you want to do regularly. Another device that we have that's also ultrasound based is Lipo Sonics. Now Lipo Sonics is stronger than Baisers Shape. It's the same idea, it's sound waves. It focuses the sound waves down under the skin and literally heats the fat to the point where it dies. It also does work, but again, that's one of those devices where you really want to see a significant result. You want to do several times. So we have also a newer device called Thermage. Thermage is a radio frequency device which is similar to Excellus. The difference is it's minimally invasive. We actually do have to numb you up and make like a teeny needle hole where this probe can go under the skin. So the reason why this has value is because we're putting the energy right to where it needs it, and we can melt some fat and tighten the skin in relatively small areas, but very effectively. So that's a new one that I'm very excited about. We also have True Vaser. Now Vaser is a device that we use at the same time as liposuction. So how this works is just at the same time as actually doing the liposuction, we put in a probe under the skin, just like in liposuction. It delivers ultrasonic energy, breaks up fat, breaks up scar tissue, and can get you either a super chiseled look, which because we can get more fat out, or it can help give you a smoother outcome if you've already had liposuction or you just happen to be one of those people with really dense fat, which exists. We can also provide laser-assisted liposuction. Now that's usually also done at the same time as liposuction, though we can do it totally separately. It's laser energy we can deliver under the skin, which can tighten the skin and everything else to try to get that area to shrink up a little bit. It's more powerful than some of the truly non-invasive techniques, but it is also invasive. We measure the results of all these devices against liposuction. Liposuction is the gold standard. I do lots of liposuction. It is a guarantee. We suck that fat out, it's gone. So if you really want the result, surgical liposuction is the way to go.